welcome to this episode of The Doctor Is In with Dr. Randall Smart. My name's Corey Brunell, and I'll be the host. And Dr. Smart, thank you again for bringing your expertise to bear here and share with our constituents, our viewers.
Corey, it's great to be here today. Great to see you again.
Yeah, it's been a while with the COVID stretch having us closed down for a bit.
Yeah, right.
Yeah. Well, another interesting topic. I know we have viewers that watch your show particularly because all the topics are interesting, and we've got another good one you wanted to bring everybody's attention to, and that's tick bites and their impact on our community and on people and how we ought to deal with them.
Right. So a lot of the shows we've done together have had some seasonal importance. You know, what happens in spring, what happens in fall, what happens in winter. And I thought it was a particularly important time of year to talk about tick bites. Tick bites start to occur around this time of year, late March, April, May, and continue through the summer. But this is the time of year where you start to see them on yourself or on your pets. And we start getting phone calls reporting bites and concern about what to do. We particularly get a number of inquiries about Lyme disease, so at some point today we should talk about that.
Sure.
But I thought it would be important for the audience to know a little bit about tick bites, how to manage them, when to freak out or not.
Yeah, right.
Yeah.
Well, about the seasonality of them, is it something where as the spring begins that they're more prevalent, or will they be more prevalent in the summer, or is there just a continual level of prevalency of ticks that until maybe winter comes back around the next year? Speak a little bit about the seasonality.
Yeah, it's Corey, it's really about their life cycle.
Okay.
And so they have three forms of development. One are the larvae, one are the nymphs, and one are the adults. And so those forms have different disease transmission rates and have different times a year. And the kinds of ticks that we're going to talk about, they have a nymph form. And that nymph form is an intermediate form. It occurs right about this time of year in their development cycle. But nymphs are about the size of a sesame seed. They're little teeny tiny things. They're not the big, calaveras ticks. They're little teeny tiny things. And so those nymphs are very active this time of year, and they're looking to feed. So they look for anything that's warm and moving, and they latch on, and so that occurs about this time of year, and that's what kind of drives some of the seasonality. I think the other thing that drives it, too, is we are more active this time of year. So we're starting to come out of our COVID shelters and into the sun a little bit and get some fresh air. And so we're out in the grass and the brush a little bit more. And it's probably a combination of all those things.
Interesting. Now, with the nymph stage here, the ticks will they move from host to host during this stage, or do they just get on a host until they have spent weeks and growing into other stages?
But my understanding is the nymph will attach and feed. They feed on blood, and they engorge, and they feed, they engorge, then they drop off, and then they move on to the next stage. And then an adult can go through that same cycle where they look for a host, they attach, feed, engorge.
Okay, and so then they do drop off. They may move to another host because the reason I asked that question, you mentioned disease transmissibility. So at what point would they acquire that disease maybe from their first host and then share it with a future host? Is that when they...
that's a great question. You would be a really good epidemiologist.
Okay.
That is a great question.
Well, I should remind our viewers, you are a doctor and not a tick expert, right?
Not maybe an entomologist?
There you go,
yeah,
entomologist,
exactly. So I don't believe that's how this occurs.
Okay.
And most experts, I think, have a different version of this. They believe the diseases caused by ticks are both viruses and bacteria. Now, in the case of Lyme disease, it's a bacteria called Borrelia. And that bacteria lives in the tick's stomach. And that's going to be an important part of what we talk about. Mm-hmm. But that bacteria lives in the tick's stomach. I believe it's endemic to the tick population, and I don't believe they acquire it through the feeding process through an infected host. Okay. I've never read that from any description. So it's endemic, it's in their gut, and then it ultimately gets into their salivary glands while they're feeding. But it's not from host to host. Mm-hmm. In fact, I'm not really aware of any disease that is transmitted from person to person through tick bites. Okay. I don't believe that happens. Not that I've ever heard of.
Yeah, that was going to be a question I asked because it makes me think of, say, malaria transmission with mosquitoes and going from host to host. So, but I'm just not aware of that type of transmission with ticks. Huh?
No, but I will tell you this: is tick bites are not a good thing.
Yeah.
I mean, in the world of things that you should try to avoid, tick bites would be one of those.
Okay.
There are just a number of diseases diseases most people haven't heard of. One's called ehrlichiosis.
Yeah,
sounds bad, doesn't
it? Yeah.
Babesiosis, that sounds bad.
Sure.
Right? Rocky Mountain spotted fever, some people have heard of that. Not a good disease to have. Equine encephalitis. So tick bites as a rule, not a good idea. Not what you want to do with your life.
Yeah.
Yeah. But I have some good news about that is tick bites are not very infectious in the first stage of the feeding and the biting. They only become infectious later.
Oh, okay. Yeah. Later along, when you say later, how long the tick has been attached to the host?
Correct.
Yeah, okay.
Yeah, correct. And this is really an important thing for the audience to know and let's say we use Lyme disease. Lyme, by the way, is the most common infection caused by tick bites in the entire country and in Europe. So even though I mentioned these other infections, Lyme is really the one worth talking about. But what happens in that scenario is a deer tick will attach to the host, and they start feeding. And so this bacteria in their gut starts moving up their digestive tract and ultimately into their salivary glands. It takes about 48 hours for that to occur. And this is pretty well documented. And even, you could argue 72 hours, but definitely 48, probably 72. So when that tick is attached to you, you're not in danger until it starts feeding, and you're not in danger until you've been at it a couple days. Mm-hmm. And that's pretty well documented. Under that time is really rare and just not reported, and people have looked at that pretty carefully. So the trick here, I think, and what we would encourage people to do is, strip down and take a look. Once a day, if you're in a tick endemic area, at the end of the day, strip down and take a look and look for anything that looks like a tick. And if you got a tick bite, remove it. If you do that, the chances of you getting any of these infections is extremely low.
Interesting. Okay, so it's not that initial bite. It's actually a feeding process of a couple days, 2 or 3 days that will
That's correct.
cause that.
Yeah, that's correct. And so when somebody gets a bite, what I would, like if you were to call me and say, hey, Randy, got a bite, what do I do? The first thing I would tell you to do is take a picture.
Okay.
Right? Now, we all have these phones with cameras, right?
Yeah.
And the first thing, because I want to know what kind of tick it is. And there are different kinds of ticks, right? There's the Lone Star tick, and that's really not what we're talking about. And there's the dog tick, very common. That's not what we're talking about. And the deer tick, which is also very common. But just identifying that tick gives me a really good idea of what the potential problems could be. Okay. So the first thing I would do is tell you, now take a picture of the tick. The other thing I will do that you might not think of is I will look at how engorged that tick is. Okay. And from that engorgement, you can get a pretty good idea of how long it's been there. Mm-hmm. You know, if it's fat and full of blood, it's been there a while. But if it's small and there's no engorgement, maybe 24 hours, probably less. Mm-hmm. So what I tell people is the first thing you do, don't fuss with it. You know, don't freak out. Take a really good quality picture so I can tell you more about what to do about it. Then at that point, I would tell you to remove the tick or come into my office and I'll remove it, one of the two. But where people get into trouble is they grab it and rip it off.
Yeah.
Not a good idea.
I've heard of home remedies, things like lighting the tick's butt on fire, trying to get it to pull its head out, that kind of thing.
Right, trying to drown it. Right.
What are the most effective tick removal strategies?
Well, those things don't work.
They don't.
So the most effective thing, and I just did a tick removal earlier this week, is what is ideal is if you have some tweezers. And you take those tweezers and you want to grab the tick carefully, as close to the skin as you can. And then you want to just tug a little bit, Now, he'll hold on, he's not letting you, he's happy. And so he won't come off right away, but you kind of tug a little bit, not hard, and he'll let go. Oh. And then you have the entire tick right there in the tweezers. Now, if you don't have tweezers, I have the tweezers, but if you don't have the tweezers, you can use your fingers if you can get it, and if you have fingernails. The experts say you need to wear gloves. I don't think you need to wear gloves, but they do. But you just want to do the same thing. You want to grab it as close to the skin as you can and just carefully pull till it lets go, and then you got it. Now, if you didn't get a good picture the first time, now is the time to get a better picture. Mm-hmm. So you can put it on a piece of paper, get some good lighting, get everything, and then you can get a really good quality picture. Right. So that would be another opportunity. And then we usually advise, if you have any alcohol in the house, to take an alcohol swab and just clean the skin really well.
What are the complications if you break that tick off and leave some of it behind underneath the skin? I would imagine infection, swelling.
Instant death.
Yeah, right.
Good question. So it's not uncommon, Corey, to leave some mouth parts in. Like if you pull too fast or, it's just not uncommon. And I've been there before where I did everything I thought was right, and at the end I've got half the tick in the tweezers and half the tick is still in the patient. Yeah. That's okay. It doesn't feel okay, it doesn't look okay, but it is okay. And so typically you don't do anything about that. Those mouth parts will come out naturally. The skin and the body will just push those out. So you don't need to get out the scalpel or the Bunsen burner. You just, and I would wash it with alcohol for sure. But those mouth parts will just come out.
Okay, so... Yeah, people would think, I would think of it kind of like a sliver where I would need to remove them. But you're saying the body just takes care of that and checks them, huh?
Just leave it alone. Your body will get rid of it.
Yeah, there's no ancillary disease to be worried about there. Yeah.
But, I'm kind of a picker. Like if I got scabs or I always pick at stuff. I don't know what's wrong with me. And so if I had this I'd probably pick at it and scratch at it. But you're not supposed to do that.
Well, yeah, your doctor probably advises you not to.
Right, exactly. Right. So that's not unusual to leave some mouth parts in. And if you do, don't worry about it. If you can't stand to look at it, put a Band-Aid on it. Yeah.
Okay, well, we've talked about some of the diseases now. If the most prevalent one is Lyme, and that's going to take 24 to 72 hours to get from the tick system into you, what are the symptoms if it does get into you? What does Lyme do to somebody, and how would they recognize, maybe I ought to go see a doctor, I had this tick I found?
Sure.
And, yeah.
Sure. So, first of all, it's not unusual to get a rash. And usually that's your body and
regardless of Lyme?
Regardless.
Okay.
Regardless. Most people that get tick bites will get some redness.
Okay.
And I've seen the redness get like big as a, soccer ball.
Yeah.
And what happens is the skin and the fluids around there react to the tick saliva. You could think of it as an allergic reaction. It's not an infection. It's not necrosis. It's an allergic reaction. It can be pretty scary because it can be big and red and can be at a place that's really visible, but that's just your body reacting to the tick saliva. So it's not unusual to get a rash. I think most people do, to be honest with you. But one of the hallmarks of Lyme disease is a particular kind of rash. And it's got a big, $20 name, but basically it looks like a bullseye. And a lot of people refer to it as the Bullseye Rash. So you'll see the little scab where the tick bite is, and then you'll see a very clear area, and then you'll see a red ring. And so it's called a Bullseye Rash. And that's pretty indicative of Lyme.
Oh, it is.
Right. And so you can get that relatively early on, within the first week or two. And if somebody has that, I usually treat them.
Okay.
Particularly if they're in an endemic area, in an area that has Lyme. But that's called Erythema Migrans, and it's very indicative. If anybody watching looks up just tick bite rash or Lyme disease rash, you'll see it. It looks exactly like a bullseye. So that's the very first stage. And then if you treat that, and the treatment's very easy, if you treat that, the efficacy of treatment is about 90%.
Okay.
So the treatment really works as long as you take the pills. It really works. They're antibiotics.
Yeah.
But in the event that you don't get treated, and not everybody gets the rash, so you could not get the rash, not be aware, and you could move into what we think of as stage 2. And stage 2 has some heart manifestations. It can cause some abnormal heartbeats. Mm-hmm. And then it has some neurologic manifestations. One of them is a facial nerve palsy. You've seen people with, kind of half their face kind of drooping. Well, there's several reasons for that. That's called Bell's palsy. But there's several reasons for that. But one of those reasons is Lyme disease. And so people with Lyme disease are at risk for Bell's palsy. Kind of a encephalitis can infect your brain and your spinal cord. So that's what we call early disseminated disease, and obviously that should be treated.
At this point, the bacteria, Lyme being a bacterial disease, this bacteria has moved to other places in your body by the second stage, and that's what... Is it kicking off poisons and toxins? Is that what causes these?
Oh, right. Pathophysiology. I don't believe we really know. Okay. But I think part of this, and this is just me talking, I think part of this is related to your immune response. Because you can treat it and eliminate all the Borrelia, all the bacteria, and then have somebody have continued symptoms, and you've proven they're no longer infected. Okay. And we think the immune system starts to react. Kind of like COVID,
yeah.
The long haulers and the immune system and the cytokine crisis. I mean, it's not that dramatic, But Lyme disease kind of does something to your immune system. It activates your immune system, and you can develop symptoms very much like rheumatoid arthritis. And in fact, a lot of rheumatologists and arthritis experts will order Lyme testing to eliminate that as a possibility.
Oh, interesting.
Yeah.
Okay, well, if somebody is seeing some of these symptoms, what's the testing process like? Obviously, they go to a medical care facility, and is it blood drawn, and how accurate are these tests? Can you speak to that a little?
Yeah, so there is testing, much better testing than when I was in training. When I was in training, we didn't have a lot at all. But there is testing, and the testing is blood tests. Occasionally we'll test spinal fluid. We'll do like a spinal tap and test spinal fluid or other body fluids. But really 9 times out of 10, we're going to test blood. And the blood is tested for antibodies. And it's called 2-tier testing. So you do a screening test, which is tier 1. And if the screening test is negative, you're done. You don't have it. If the screening test is positive, you may not have it, or you may. And you go to tier 2, which for those of you in the audience that are medical people, that's called Western blot testing. And tier 2 Western blot testing is regarded as confirmatory testing. So you could have tier 1 positive, tier 2 negative, you probably don't have it. Tier 1 negative, you don't need any further testing. Tier 1 positive, tier 2 positive, you probably have it. But you can really get fooled. I mean, Western blot testing is known for some false positives and false negatives. So for Lyme disease, the test is never done in isolation. It is done with clinical expertise. You know, what are your symptoms? Where were you bitten? Were you in an endemic area? How long was the tick on? Was the tick engorged? What kind of tick was it? All those things end up creating what we call a pretest probability. And then the testing is kind of regarded as confirmatory testing.
Okay.
So just like testing everybody in the county for Lyme disease, you'd create mass confusion.
Okay.
Some would be positive, some would be negative. Nobody would accomplish anything. Right.
Well, let's talk a little bit about prevention. Well, I guess before we get there, were there any other symptoms that people ought to be aware of and look for? Are there fevers, aches, pains?
Sometimes headaches.
Headaches, okay.
Yeah, headaches can be part of this. And what we call arthralgias versus arthritis. And arthralgia is joint pains that kind of move around. You know, for a day or two it might be the shoulder, and a day or two a knee, and then maybe both hips, and then it goes back to an elbow. And so it's kind of these migratory arthralgias, not arthritis. And that's a hallmark. Obviously the Bell's palsy thing you should look for. Headaches. Fever isn't a big part of this.
Okay.
The rash we talked about.
Are there long-term consequences to somebody who, okay, you get Lyme, the antibiotics take care of it, and then are they pretty well done with it, or could there be long-term? This is assuming it's been treated and treated successfully.
You read the book.
No.
So
version,
there is something called Post-Lyme Syndrome.
Oh, okay.
Yeah. And Post-Lyme Syndrome are patients who have had documented Lyme disease, and they continue to have these immune symptoms afterwards, and that's called Post-Lyme Syndrome. It's really a specialty disease. It's not rare. It's not common. But there is a post-Lyme disease that can include arthritis, malaise, just I don't feel well, almost kind of similar to a post-COVID thing.
Well, it gets to what you said about maybe the immune system still being activated and
Exactly.
getting after something that's not there any longer.
Exactly.
Well, we don't have but a few minutes left, and we do need to talk a little bit about prevention. When you think,
just don't go out in the brush.
Yeah, there you go.
Right.
Well, you mentioned areas that some are more endemic of this than others. So if somebody was going to go to an area, I imagine they could Google which area, whether there's Lyme disease in an area they're traveling to. Clothing, covering.
Right.
What about insect repellents? They
do work. There's a medicine called pymethrin, which you can spray on your pants and clothing and boots. You can tuck your pants into your socks. That can be really helpful. Certainly checking your body afterwards can be really helpful. The endemic areas in California are up on the north coast. Mendocino, Fort Bragg, Humboldt. Those areas, some around San Jose. The foothills have very little of this. In fact, they really have none. All the cases we identify here are imported from somewhere, like somebody vacations in Connecticut or Virginia or North Carolina, which is totally endemic, and then they come back with it. So right, you're exactly right. Find out if the area is endemic. Tuck your pants into your socks. Some pymethrin will help. Just being smart about what you do, looking for the ticks, and then removing the ticks when you find them.
Yeah, within a reasonable time frame, and then even if the tick is infected, you're all right. Huh?
Right. That's exactly right, Corey.
Yeah. The type of ticks you mentioned earlier, as well as getting a picture. Can you mention the names of those or the types of them?
Yeah, so the ticks I'm familiar with are the deer tick is the one that carries Lyme. A deer tick has a sort of a maroon-brown butt and black legs. It's called a black-legged deer tick. Okay. Then there is a Lone Star tick, and that's pretty easy to identify because it has a white dot right in the middle of it. Lone Star, right? Yeah. The dog tick is those big ticks on dogs. They have more of a kind of a mottled pattern. But those are the ticks in this area that I'm aware of. Okay. And the dog ticks are harmless. You get a dog tick on you, it just makes for a good story, but it doesn't, you're not going to get sick.
Well, very good. Well, Dr. Smart, thank you very much for bringing this topic to our attention, giving us some more information about it, about the risks of it, and the ways in which we can avoid tick bites and the complications they can cause.
My pleasure, Corey.
And thank you to our viewers for joining us again on this episode of The Doctor's In. See you next time.